Winning this alumni award is, in a way, an affirmation of the fact that I've spent my medical career here in Indiana. It doesn't seem like it's been this long, but I came in 2003 for medical school, and I never left. To be recognized by the Alumni Association is a real confirmation that this is a great place. People love being here and they want to stay here. So a lot of the work that I have done in my career thus far has been focused on perinatal medicine. So the period, right before birth and the period right after birth. That means that I focus on a lot of high-risk pregnancies and what we call fetal medicine. One of the things that I've been really focused on is how can we know more about this patient that we can't even see? The younger a human being is, the less able they are to express themselves. An adult can tell us what's wrong. A child, maybe less so, but a pregnancy, you can't talk to the fetus, and you can't look at the fetus, you can't do a physical exam, and so through medical imaging, we're trying to understand more and more what problems this family faces. The parents obviously have a lot of anxiety and concern once they realize that something might be wrong with the pregnancy, and they're very eager and vulnerable for the help that we can provide, and so I like to think that my work and the work of this huge group of really talented people that I get to be a part of is focused on revealing what's hidden. In many ways, pregnancy, it's visible on the outside, but there's a lot going on that's hidden.
One of the things that is most interesting about Brandon and his involvement in the Fetal Center is he is a radiologist, and he was instrumental in the initial group in making this Fetal Center come to fruition. He was one of the founding members, and for a radiologist to be a key part of that, I think really demonstrates who he is. His commitment to bringing us forward and what we can do for our patients with a focus on things that would be groundbreaking for IU Health, be groundbreaking for Riley, speaks to who he is. There are no barriers, and if they are there, he's the kind of person that wants to knock those down. So I think of Brandon first and foremost as a good human. He is dedicated to his family. He's dedicated to the people that he works with. He's dedicated to his patients. So I think, he brings all that is good in everything that he does.
I think there's a lot of reason for hope when looking at the future of medicine, when looking at the students and trainees who are coming up into the field even as we speak. And I love the way that the students here at Indiana University and the trainees in my own work in Riley Hospital remind me that we can't be satisfied with what we've already done, and we can't be content to just do the same old thing that has happened before, but to really ask ourselves with conviction and intention, what else can we be doing? These are some of Indiana's most vulnerable. These are, some people might say the least among us when they're desperate or injured or diseased. We owe them every ounce of our effort and our intention, and the students I get to work with keep that at the front of my mind.